Madam President, the Senate will have before it today or tomorrow, depending upon the flow around here, two very misguided bills. This will come about on when we have our budget come up for a vote here under an agreement to get that budget up. We're going to have a vote on two separate bills. One bill would totally repeal and defund the Affordable Care Act, the health reform bill that we passed. The other one would prevent funding for Planned Parenthood. So I want to take a few minutes here on the floor of the Senate to speak about how misguided these two bills are. First, let me talk about the bill that would defund the Affordable Care Act. This bill that we would be voting on will prohibit any funds appropriated this year and any funds appropriated in any prior year from being used to carry out the Affordable Care Act. This would remove the engine from health care reform when the train is steaming down the track. So again, why are we voting on this? The reason is that Republicans have tried a frontal assault on the Affordable Care Act, a debate on the merits, and they failed. This body voted down Senator McConnell's amendment to the FAA authorization bill that would have repealed health reform in its entirety. But I guess what you can't do directly, you try to do indirectly. So now, Republicans are trying to undermine health reform by other means, such as defunding it. Well, this strategy only makes sense if you're absolutely obsessed with tearing down health reform. Make no mistake about it, this bill is the equivalent of repeal. By depriving the bill of all funding, it would turn back the clock on all that we have accomplished over the past year. It would take us back to the bad old days when insurance companies were in the driver's seat, telling you what kind of health care you're entitled to and when you're entitled to it. Instead of protecting all Americans against arbitrary limits on coverage, repeal would take us back to the days when insurance companies could turn off your coverage just when you are the sickest. That would hurt families like the Grassoffs from Texas, who testified before my committee earlier this year. They were unable to find coverage that would pay for their son's hemophilia treatment until the Affordable Care Act banned lifetime limits. Instead of allowing young people starting a new job or a new business or going off to school to stay on their parents' insurance until age 26, repeal would make them fend for themselves in a chaotic market that offers too little coverage for too much money. That would hurt folks like Emily Schlichting, who suffers from a rare autoimmune disorder that would make her uninsurable in the bad old days. But because of the Affordable Care Act, she's able to stay on her parents' policy until she's 26. Again, at a Health Committee hearing in January, this is Emily, a wonderful young woman. She said, "Young people are the future of this country, and we are the most affected by the reform. We're the generation that is most uninsured. We need the Affordable Care Act because it is literally an investment in the future of this country." It would hurt folks like Carol in Ankeny, Iowa, whose 19-year-old daughter was diagnosed with type 1 diabetes 9 years ago. Thanks to the Affordable Care Act, Carol doesn't have to worry about her daughter's pre-existing condition disqualifying her for insurance coverage. And she can stay on her parents' health insurance coverage after college. Carol also doesn't have to worry about the cost of her daughter's care running up against a lifetime cap that would be imposed by an insurance company. Health reform banned those limits. Carol wrote me a very nice letter to say, "Thank you for doing the right thing." Madam President, instead of protecting nearly half of non-elderly Americans who have pre-existing conditions like high blood pressure or diabetes or heart disease from denial of coverage, repeal would put insurance companies back in the driver's seat, picking and choosing whom to cover. Instead of helping small businesses struggling in this recession with the cost of insurance premiums, repeal of the Affordable Care Act would take away $40 billion in tax credits that reduce premiums for small businesses. Instead of helping all Americans prevent illness or disease by providing free preventative services like mammograms and colonoscopies, repeal would allow insurers to charge expensive co-pays for these important services, thus discouraging people from getting colonoscopies or mammogram screenings. If we pass this bill to defund the Affordable Care Act, Congress will turn its back on America's seniors, tossing out hard-won improvements in Medicare benefits and damaging the program's fiscal health. It would reopen the Medicare Part D donut hole, exposing millions of seniors to the full cost of drugs when they need the most assistance. Repealing the Affordable Care Act would increase seniors' drug prices on average by more than $800 this year and $3,500 over the next 10 years. It would roll back the unprecedented investment the Affordable Care Act makes in Medicare fraud prevention. Turning back the Affordable Care Act would hurt seniors' access to health care in rural areas by eliminating incentive payments that are in the Affordable Care Act paid to rural primary care providers. Repealing or defunding, as this bill would do, defunding the Affordable Care Act would roll back improvements to Medicare payment policy, coordination, and efficiency that extend the life of Medicare Trust Fund by over a decade. In addition, Madam President, Secretary Sebelius has informed us that payments to Medicare providers would be significantly disrupted by this bill, which again will defund the Affordable Care Act. Finally, we come to the part of this debate that even Alice in Wonderland would have a tough time understanding. The House Republicans have played the Washington stage for all it's worth over the last few weeks, making great solemn speeches to the balconies and to the audiences about the deficit and the debt. But as a condition for agreeing to fund the government for the remainder of this year, what are they demanding? They want to defund and thus repeal the Affordable Care Act, one of the best and biggest deficit-reducing measures in decades. The Affordable Care Act reduces the deficit by $210 billion in the next 10 years, more than $1 trillion in the next 10 years. And again, here's a chart that shows that. In the next 10 years, according to the Congressional Budget Office, the Affordable Care Act will reduce the deficit by $210 billion. Therefore, if you repeal it, you would increase the deficit by $210 billion. But here's where the real savings come. In the next decade, the Congressional Budget Office says that the Affordable Care Act will reduce the deficit by $1 trillion. So if you defund it, as this bill would do, you will increase the deficit by $1 trillion. That's what the Republicans want. They want to absolutely increase the deficit. They must, because they want to do away with the Affordable Care Act. So let me get this straight. The Republicans are proposing to reduce the deficit by increasing the deficits. As I said, somehow I have a feeling when I hear that we're not in Kansas any longer. This is Alice in Wonderland kind of thinking. So, Madam President, we had to stop the silly games. This debate isn't about deficit reduction. It's about tearing down health reform. No matter what. No matter if it does increase the deficit, get rid of it. Get rid of health care reform. It's about giving control back to wealthy, powerful health insurance companies who can raise your rates, deny you benefits, and make increasingly more profits. Nothing makes the nature of the agenda of my friends on the Republican side more clear than the 2012 proposed budget released by the Republican House Budget Committee chairman last week. The Republican budget plan is very simply a massive transfer of wealth. A massive transfer of wealth from low and middle income Americans to the wealthiest in our country. 2/3 2/3 of the budget savings in the Republican budget proposal come from drastically cutting programs that serve those with modest means, while permanently extending President Bush's tax cuts for the rich. And how is this massive wealth shift paid for? Well, they would repeal the majority of the Affordable Care Act, taking coverage away from more than 32 million Americans who would be covered under current law. Starting in 2022, the Republican budget proposal eliminates Medicare as we know it, turning over the program to private health insurance companies. Instead of enrolling seniors in Medicare, the Republicans' plan would give them a voucher to go out and buy private insurance coverage on the open market. And since the voucher would not keep up with rising medical costs, seniors would fall further and further behind. The Congressional Budget Office has said that this would more than double out-of-pocket costs for seniors entering the program in 2022, would triple the cost by 2030. And where would that money go? Well, to the private health insurance industry. Well, that sounds kind of familiar, doesn't it? The Republicans' obsession with repealing the new health reform law is not based on budgetary considerations. It's based strictly on ideology. In 1965, President Johnson and this Congress passed Medicare, ensuring seniors access to decent health care. Republicans fought it bitterly then. 45 years later, they're still trying to undo it. And here they go again. So the choice before us is to go forward or to be dragged backward. Let us come together as a united American people to create a reformed health care system that works not just for the healthy and the wealthy, but for all Americans. Now, Madam President, there's a second bill that we will be voting on in conjunction with the budget. The Republicans insisted on this in order to have a vote on the budget. It is as equally misguided and as dangerous, I think, as the other bill. This second bill would prohibit a law-abiding, an extraordinarily successful organization from participating in fair competitions for federal funding. This entity would, of course, be Planned Parenthood. Now, again, let's be clear what this bill is not about. It's not about the need to prevent federal funds from being used to pay for abortions. Long-standing rules under the Title X program already strictly prohibit the use of taxpayer dollars to fund abortions. What's more, every appropriations bill for the last 2 decades has stated that no funds can be used for any abortion. So, Madam President, this bill is not about abortion. It is about banning a specific organization from even competing for federal funds simply because some people don't agree with that organization. This would create a very disturbing and dangerous precedent. When Congress creates a program, it typically specifies rules or criteria for participation in that program. Any organization who agrees to play by these rules and criteria is eligible to compete. Planned Parenthood is playing by the rules. That's one reason it is one of the most widely respected health care providers in the United States. Of 5.2 million women served every year by the Title X program, 1 out of 3, 31%, receive care at Planned Parenthood health centers. Now, if someone can show me a specific clinic that isn't following the rules, by all means, take away their funding. But that's not what this bill does. This bill says that Planned Parenthood, as an entity, would be banned from even competing to provide services under Title X, despite the fact that they conform to all of the rules of the program. And it doesn't only just ban Planned Parenthood from offering family planning services. That's one aspect of what Planned Parenthood does. But this bill would turn away nearly 1 million women a year who receive cervical cancer screenings through Planned Parenthood clinical services, as well as 830,000 women every year who get breast exams at Planned Parenthood clinical services. It would turn away countless hundreds of thousands of women and men who receive physical exams and immunizations at Planned Parenthood clinical services. Madam President, my office has been deluged by emails and phone calls from Iowans and other Americans who oppose this misguided effort to ban Planned Parenthood from receiving funding under Title X. I stand with them in support of the important services these clinics provide to women and men throughout the country. A constituent of mine writes, "Dear Senator Harkin, I want to let you know that cutting funds to Planned Parenthood will jeopardize the lives of many women and some of the men who go there for basic reproductive health screenings. I say this with confidence, as Planned Parenthood was the only clinic I could afford 10 years ago to obtain yearly pap smears. It was Planned Parenthood that found my cervical cancer and referred me to a specialist for treatment. Due to the existence and actions of Planned Parenthood, I am alive today as a healthy and contributing member of society. I work with undergraduate and graduate students, and several of them have mentioned that Planned Parenthood was their only option for affordable screenings. Please ensure that government funding will be allocated to Planned Parenthood. Please do not have young or socioeconomically strapped women potentially lose their life over a cancer that is remedied when caught in its early stages." That was the end of her letter. Madam President, we need to listen to voices like this. We need to listen to the women of America who rely on Planned Parenthood. Finally, Madam President, I believe this bill goes to the heart of whether we can reach common ground on something we should all agree on: the need to find ways to reduce the need for abortions in America. Now, let me say at the outset, I strongly believe that we must preserve the right of every woman to her own reproductive choices that exist under the Supreme Court's decision in Roe v. Wade. But to reduce the number of abortions, we must prevent unwanted pregnancies, just as we must also support women who want to carry their pregnancies to term. That is precisely what Title X funding accomplishes. Family planning services at Title X health centers, including Planned Parenthood, prevent an estimated 973,000 unintended pregnancies a year. And this, in turn, obviates what a woman might turn to in desperation for hundreds of thousands of abortions every year. Unfortunately, during the debate on Planned Parenthood in recent days, we have heard many wild and inaccurate claims about the work of this dedicated organization. On that score, I've always agreed with our former colleague, the late Senator Pat Moynihan, who said that, quote, "People are entitled to their own opinions, but they're not entitled to their own facts." Well, last week, our distinguished colleague, the junior senator from Arizona, stood here on the floor of the Senate and stated that abortion, quote, "is well over 90% of what Planned Parenthood does," end quote. Stated right here on the Senate floor by the junior senator from Arizona. Of course, that is grossly inaccurate. Planned Parenthood spends the overwhelming majority of its resources keeping women healthy and preventing the need for abortion in the first place. The fact is that just 3% of Planned Parenthood services are related to abortion. When news organizations asked the office of the senator from Arizona for evidence of his claim, a spokesperson bizarrely stated, and I quote, "His remark was not intended to be a factual statement." End quote. Well, what was it intended to be? Madam President, the floor of the Senate is not a place for destructive and false assertions, especially when used to argue that an organization should be redlined and singled out for discrimination. For the record, Planned Parenthood is one of the most respected women's health organizations in the United States. It courageously defends the right of women in America to make informed, independent decisions about their health and family planning. And by providing women with counsel and contraception, Planned Parenthood prevents countless unwanted pregnancies and thereby reduces the number of abortions in this country. And Madam President, lest there be any misunderstanding, I intend this as a factual statement. Now let me conclude by making clear that the one certain impact of this bill, if it was passed, will be to increase the number of abortions in America. This bill would dramatically erode the effectiveness of Title X in preventing unintended pregnancies, preventing sexually transmitted infections, detecting cancers early, keeping people healthy through quality preventative care. It would have this impact because this misguided bill would ban an extraordinarily successful organization, Planned Parenthood, from providing these services. So on this bill, we have to say no to unintended pregnancies and unnecessary abortions. Say no to this misguided and counterproductive bill. So, Madam President, we have this vote on the budget, but then we have these two sideline votes. One that would defund the Affordable Care Act and send us back to the bad old days of health insurance companies deciding who gets what when at insanely big profits to them. Secondly, it would ban Planned Parenthood from even applying to be a provider of health resources and services to 5.2 million women every year in this country. So, Madam President, I hope that the Congress, the Senate, will rise above these misguided bills, will rise above unfactual assertions made upon the floor of the Senate, no matter how they were intended, and we'll make sure that Planned Parenthood can continue to provide the vital services it does in this country. Madam President, I yield the floor, and I note the absence of a quorum.